Great. Hey, everyone.
Hello, everyone.
Hey, everyone.
How are you?
Good. How are you?
Good. I'm not nervous about public speaking, but for some reason, I think because this is my first time like publicly speaking via Zoom, like
Yeah.
I don't know,
Yeah,
it feels new for some reason, and I don't know why.
It feels like even though we're talking to each other, it also feels like I'm talking to myself. Feels a bit strange. How are you doing, Rosie?
I'm well. I'm a little bit under the weather, but I'm okay.
Good. Are you feeling a bit better than the other day?
No, no, but I look better.
Yeah.
I thought like before.
Okay. 3 of us are wearing a shade of yellow.
Love it.
Right, that's what I noticed.
Yeah, Ben, you missed the memo.
It just had to be different.
Yeah. Do I look really dark to you guys? It's like the lighting a little bit weird on my camera.
The lighting is coming in more from the right side of your face.
Yeah.
So you should turn your camera like that way.
Is this better?
Yes.
Yeah. All right. Cool. How are you, Ben? I think you're still on mute.
Thanks, sorry.
All right. How's your day going?
Not too bad, yours?
Good. How are you feeling about today? Feeling nervous, excited?
No, it's gonna be good. Are you guys seeing my name pop up in 2 spots on the screen?
Yes.
Nope, I only see one.
I have 2.
Yeah, because I closed the previous application. Hopefully it goes away.
Yeah, it looks fine on my screen. I see two Fierte.
Oh, there it's gone.
I was hoping that Jaden would be here, or maybe someone from Capital Pride, if they're listening, could answer this question. But how do we end this panel? So I was just going to conclude and thank everyone for being here. And also before that, I was going to ask if anyone else has any extra information to include. But do I just like hang up the call? Or do we just like stick around for people
I would imagine, yeah, that like thinking Capital Pride and is Vive Healthcare?
Yeah, Vive.
Oh, Catherine wouldn't. Yeah.
Catherine on the call. Okay. Okay. Great. And do we want to leave our contact information with people? So just in case like any viewers have questions for us directly or have questions that were unanswered during our discussion, do we want to provide our email?
Is there one place they can all go to and then they can be sent to us individually if there's questions, like as opposed to our personal contact?
I like that idea. Folks can message Capital Pride and they can contact us to reach us.
Cool. That sounds good. Yeah.
Are we doing just first name? I don't want to.
Oh, yeah.
Yeah, right. Just first names and pronouns. Okay. Cool. Is anyone nervous about anything or feeling pretty confident, comfortable?
No, we're going until 4:30, right?
Yeah. So I've kind of aimed to finish at like 4:15, and then I feel like we'll probably go longer, so I just aim to finish early.
See how it goes.
Yeah. Yeah. Has anyone ever done like a Zoom workshop?
No.
Yeah.
Okay. Like I'm just nervous because like it's not gonna have like the same energy as like a room full of people. And
Yeah. The other thing too, I just did this like a little mini workshop on like working with Zoom for nonprofit.
yeah.
One thing that took away from that too is also it's a different timing, so they're not being thrown off by these natural pauses and silence.
Yeah.
Yeah, that's helped me a lot as a person who is very chatty to just make sure you give a break.
So, just yeah, so I didn't shorten the introductions. I was like just the introduction that you sent me, Robert, like you shortened it yourself. So that was the only thing that was shortened for the intros. It's like I feel like they're actually quite short, and like my whole introduction, including introducing the three of you, takes about like 5.5 minutes. So it's not going to take up too much of our discussion time. And so I only received something from Ben about what you're excited about for Virtual Pride. So that was just how I was going to conclude the intros for everyone.
I can send that to you now. I forgot to send that to you. I apologize.
That's okay. But what Ben said was a great way to kind of conclude and end it. So what are you teaching at Algonquin College, Rosie?
It's called Foundations of Anti-Oppressive Practice.
Cool. Like, have you been teaching that course a long time, or?
No, my first semester was last year.
Awesome.
I'm actually shocked that they asked me back because that was
Yeah.
a faster on its own, but I guess you it's something that you learn by doing.
Yeah, definitely.
Is everything online? Obviously, everything's online for you now, Rosie. And
I absolutely despise it.
Yeah.
I hate being online. I don't know. I'm a millennial, yes, but I'm not like a technology person.
yeah,
I'm one of those millennials who actually played outside.
it's hard to connect anyway with people. Like, I don't know. It's a different type of connection with the people you're talking to.
Yeah, definitely. I taught an online course last year, and it was just really strange because like you just facilitate these like online discussions, and then students pick someone to reply to. And it just doesn't feel like a real class.
No, it doesn't.
Yeah. But yeah, I also just like hated like the online dialogue, just like interface of the. Like, the
And I'm
things that
like,
you-
I'm gonna force people to have their camera on, probably.
Yeah.
I'm not gonna sit here and like have your camera on and
Yeah.
Because I have to reach out to you. I'm teaching a course at Algonquin in the fall as well.
What are you teaching?
It's not really teaching, actually. I'm a placement coordinator for the community health program. So I'm just going to be overseeing students with the project.
Look at you! Is it full time?
We're live.
Oh, we,
Just click the memo.
isn't it in like 2 minutes?
Yeah. So yes, we're getting started. Happy Pride, everyone, and thank you so much for joining our virtual Pride panel discussion, POZ in the Pandemic. So despite these really challenging circumstances we're all living in, I'm really glad that technology can still bring us together for these really important Pride events to keep the LGBTQ2I+ movements going strong. So there's a really great schedule of events this week for Ottawa Pride. So if you'd like to learn more about them, please check out the Capital Pride website at capitalpride.ca. And please attend some of the events to keep this movement going. So before we get started, I want to just briefly introduce myself. So my name is Victor. I'm the moderator for today's panel. And so I've been a social worker in the community for about 8 years now, and I got my start at AIDS Vancouver working in an HIV prevention program. But since that time, I've moved here to Toronto, where I'm currently based, to work in community health with newcomers and refugees to provide trauma-informed therapy. And I've recently started my own practice to continue providing free trauma-informed therapy and some sexual health counseling to LGBTQ2I+ newcomers and refugees. So I'm very excited to be part of today's conversation. I know like the energy might be missing because we're not in like a crowded space, but I hope that our discussion is interesting, engaging, and people find it useful. So today's panel is called POZ in the Pandemic, Living with HIV/AIDS During COVID-19. So today we're going to discuss with our very diverse group of panelists the experiences as well as some supports and services for folks living with HIV and AIDS during COVID-19. And this panel would not be made possible without our friends and partners at ViVe Healthcare, Max Ottawa, AIDS Community Ottawa, and also of course Capital Pride. And finally, I want to recognize that Ottawa is located on unceded and unsurrendered territory of the Algonquin Anishinaabe Nation. And we extend our respect to all First Nations, Inuit, and Métis people for their valuable past and present contributions to this land. And we also recognize and respect the cultural diversity that First Nations, Inuit, and Métis people bring to the city of Ottawa. All right, so now please join me in welcoming our great panelists. So first we have Robert Alsbury. So Robert is a registered nurse who works at Max Ottawa as a communications coordinator. And since moving to Canada in 2016 from the United States, he's participated in and helped facilitate many queer, Black, and HIV/AIDS groups, including Keeping It 100, a Black queer men's discussion group. He's also a proud member of the steering committee in the Black Gay Men's Network of Ontario. So thank you, Robert, for being here today.
Pleasure.
Robert.
Great. And so next we have Rosalind Charles. Rosie is an educator, activist, practicing doula, and part-time professor at Algonquin College, and currently living on unceded and unsurrendered Algonquin territory, also known as Ottawa. Rosie is interested in the intersections of racial, food, and gender justice. They like to uncover the persecutions that affect Black people's lives, like the carceral system, education, health, art, parenthood, environmental degradation, and disability justice. Rosie is a graduate of the University of Ottawa in Women's and Gender Studies. And Rosie was born in Montreal, raised in Brooklyn, and fashioned with a brief stay in her ancestral land of Haiti. So welcome, Rosie, and thanks for being here.
Hey, Rosie.
So finally, we have Ben Gunter. So Ben is a registered pharmacist who has been working in Ottawa over the past 14 years. His pharmacy focuses on the HIV treatment and prevention strategies. He is also the vice president of the Ottawa Carleton Pharmacists Association and serves on the National Capital Pride Run organizing committee. He recently collaborated on the development and execution of the first pharmacy-delivered HIV testing pilot program in Ontario, which provides rapid HIV testing with pre- and post-test counseling services to individuals in his local community. And what Ben is most excited about Virtual Pride this year is how Pride is using technology to connect all of us. And although that we can't all be physically together, it's great to see these creative avenues that we're taking to keep Pride going strong. Thank you so much for being here, Ben.
Thanks for having me.
Great. Well, so over the last week, community members have been submitting questions and topics that they'd like our panel to discuss today. So as you guys can see, we have a really diverse group of panelists here, and I'm very excited to hear more about their experiences and perspectives on the current climate of HIV and AIDS during the pandemic, while also fielding questions from our community. Right, so without further ado, let's jump right in. And I'll also be keeping track of time just so then we get to all the questions as well as not to go over. So I might like stick up my hand or just kind of politely interject if things are getting a bit long. All right.
Sounds good.
So it's been a very strange time for a lot of people, and access to services, resources, care providers, friends, or families have been greatly limited and impacted. And relating this back to the experiences of people living with HIV, like Ben as a pharmacist, have you noticed it hard right now for HIV positive folks to get access to treatment and medication?
Luckily, there haven't been any medication shortages for HIV meds. However, when the pandemic first hit back in mid-March, we were a little bit afraid of a bit of medication hoarding that might happen. So we were afraid that people would rush out and maybe stockpile medications, not unnecessarily, but in large amounts. And we were a little bit worried about the supply chain. So we were kind of just worried that the people that were manufacturing the medications, if they were having COVID outbreaks in their factories, not being able to manufacture, that could put delays to importing the medication to Canada, and then pharmacies could run short. So what we did in the pharmacy is we did a reduction from 3-month supply down to a 1-month supply for patients. Essentially, it was just to slow the speed of the medication leaving the pharmacy so that we could give more people access to more medications in case there were any disruptions in the supply chain. But luckily that didn't happen, but we were proactively doing that. We were kind of worried about the toilet paper effect, how everyone at the first of the pandemic was just grab, filling up their carts. And we didn't want this to happen with medication, because as we saw with something as simple as toilet paper could happen, it's like if there's a disruption to HIV medications, that could severely impact people's treatments. However, we did work with patients because we did understand that some people couldn't just take 1 month of medication. Some people didn't want to come out. We were delivering to those folks. We were also giving 3 months of medications to persons that did need it. So I would recommend, if such a situation ever comes up, to just talk to your pharmacist and explain it. If you do require more than a 1 month, or if there's special circumstances, just to have that conversation with your healthcare provider, because usually just by opening up the lines of communication with them, they can help explain what's going on, and then the patient can explain their side of the story, and we can come to some kind of agreement that works out for everyone.
Great, thank you, Ben. So it seems like you and your pharmacy, you guys have been really proactive in kind of changing the ways that you are able to provide like treatment and support for people living with HIV. And but maybe for Rosie, what else do you think you can do to help ensure people living with HIV can continue to get adequate access to treatment and medication during this time?
I mean, there's a lot of things that we can do. As Ben said, I think a lot of the pharmacies have been proactive and trying to find strategies to help people with their medical needs with the medication, basically, like with what you need to survive physically. But there's also things that we need to think about, how people are going to survive with their mental health, and probably also the feeling of isolation that comes with being in a pandemic and where people have to stay home. I work at the AIDS Committee of Ottawa, and my job is the Women's Outreach Coordinator. And what I've seen is that a lot of people, because people don't just have HIV, they're also immigrants, they're also single parents, they also have other identities that intersect and make it difficult for them to feel connected to community. So I think paying attention to people's mental health and the other identities that may make their life more difficult or feel like more isolated. And I can imagine that it's not that I can imagine, I know that for a lot of people with HIV, it's also very triggering when we think about the stigma that comes with like catching something like a virus, and like people having shame in getting tested. And we know that with the AIDS epidemic, like one of the ways to counter a virus that is spreading quickly is to know who has it and what to do about it. So now that testing is a thing, I think we should actually reduce stigma in order for people to actually go and get tested and to see who has it, because the asymptomatic cases are very real. And I think that people can actually look to people who have HIV, especially people who have HIV for a long time and who've seen the first the HIV epidemic happen, and can learn from those lessons around testing and like reducing isolation and taking care of people's mental health, because that's also a silent killer.
Definitely, yeah. I think when we start thinking about treatment of HIV, we think only medication, but like HIV is, like as we all know, is such a complex and very like evolved kind of virus, and we need to look at it from a very like diverse, like from a diversity of perspectives. Do you have anything to add, Robert, about like maybe back to our previous question about like, is there anything that you can think of to help ensure that people living with HIV can continue to get adequate access to treatment, medication during COVID?
Yeah, and adding on to what Ben and Rosie were saying, I think the longer that we're dealing with COVID, we are seeing what inequities and structural issues look like. And as you mentioned, where we're at with HIV is that it is a chronic manageable disease, but there's certain things that have to be in place to make it such. And I think, you know, initially early on, as we saw services redirected towards acute care, meant that people didn't have access to lab work or access to their service providers in ways that they had before. So there was a lot of anxiety over, you know, getting that routine care that's important to HIV. And certainly as the longer we're going on and we're seeing people, you know, having to work less hours or maybe lose their jobs, how does that affect their insurance to get access to pay for medications? So thinking about all the social service support, you know, and all of these things have been impacted, right? So we're dealing with decreased, already underserved, under-resourced agencies, you know, trying to access, you know, get folks connected to supports that they need. So it's really a, you know, a cluster effect that gives, there's a lot of reason to give a lot of thought to a lot of things.
Great, like, thank you for that as well. And like, I definitely kind of recognize like how difficult it is for social services to continue to keep up with the need in the community. And but Rosalind, Rosie, you already touched a little bit on this, But maybe from your experience as an educator, activist, doula, adjunct professor, outreach worker, person of many hats, like, how do you think as allies can we support our friends living with HIV, particularly during this period of this global pandemic?
I think that's a very good question. I think it's difficult because I do think that we should actually listen to the people who are affected by by what you want, by what we're speaking about. So I think listening is a very, very important thing. And also going the extra mile. You know, like when people say a lot of our jobs center around like giving people referrals to somewhere, but what does it look like when you actually call for that person? What does it look like when you actually follow up? And especially if you work for an organization, like say if you work for Max, if you work for a pharmacy, if you call with your voice and say, I am calling from this organization, and how can I help this person? People tend to listen to you more, as opposed to if I was an individual saying that I'm seeking this help. Because there's some sort of like connection that you have. So like you have some kind of social capital when that happens that needs to be used. Because as Robert said, for HIV to be a manageable disease, some things have to be in place. So what does the person's home life look like? Can you help in that sense? Does the person have an adequate support system? If not, can you help the person develop that? And what role can you play in that support system? Because it's kind of like give a man a fish and teach a man a fish. And it's like, sometimes you actually have to go that extra mile and call and make sure that you follow up. And it could look like daunting, and it is going to be, especially if you work in that sector, in the global pandemic. Because while a global pandemic is happening, other pandemics are happening too. Like we know, like domestic violence has gone up. So criminalization with HIV is probably going to go up. All these things are going to like amplify when you have the factor of like, everyone is like, we have to stay home and protect ourselves. So I think going the extra mile is really important, listening and following our words with action. And I think it's really important to not make promises that we can't keep.
Definitely. So really expressing a genuine interest to actually help. So if we say we're going to do something, you better do it.
Some people can't what they need. So offering what you can.
Definitely. For sure. So, and you also mentioned that, we really need to listen to the people that we're like offering help to. We need to hear what they're actually saying. But maybe Robert, as your role as like a communications coordinator, do you think there's like any additional messaging that you'd like to share with allies when they're trying to understand what they can do to really support the HIV positive community?
Yeah, I think first and foremost, whether it's, speaking personally and professionally, is knowledge is most important. And unfortunately, 40 years of having discussions of HIV in our world, there's still a lot of misinformation and a lot of wrong information. So I think in terms of, in thinking about being an ally, all of us individually have to make sure that we have accurate, up-to-date knowledge of HIV, right? There's still stigma. I was just on Instagram the other day, and there was a young person who was sharing a very negative interaction that they had on Grindr with an individual. They disclosed their status before a sexual encounter, and just unfortunately found themselves just caught in a negative tirade of just misinformation. So I think that that's key. We're still combating, HIV 101 and misunderstandings. And I'm sure Rosie and Ben have stories of that as well. And I think in addition to, from a professional lens, it's really just, as we're saying, amplifying what's out there, what folks can access, how they can access it, as Rose is bringing out, not just being an ally, but also being an accomplice. If we have the capacity to go those extra steps, to involve ourselves. Yeah, and we're all, the 2020's taught me a lot of things, one of which is grace. And I've definitely been finding myself wanting to be treated as kindly as I'm trying to treat other people, and the fact that we're all dealing with this in some way, shapes, or forms. All of our mental health is impacted. I think also in being an ally, keeping in mind that HIV, people living with HIV, if you have a friend or know someone, it's really just a matter of just calling and saying, you know, not just, is there anything that you need? Let me know, like, what can I do for you? And ensuring that there's a plan for you to do that.
Right. Yeah, I think when we're all willing to help, we always just kind of come in with our own ideas, and we often neglect the people that we're actually trying to help. And what you touched on is like to grab accurate knowledge and information. And I think that accurate knowledge and information comes from the people that we're kind of serving. And but kind of returning to Ben, so like with this idea of like accurate knowledge, not getting misinformation to develop more stigma, like can you provide us like maybe a medical perspective of maybe whether or not you feel that you think that HIV positive people are like maybe more vulnerable to COVID-19 or not? Like, can you kind of help clarify whether or not like HIV positive people should be like hyper vigilant, more aware of their health during this pandemic?
For sure, that's a really good question, and it's multifaceted because we look at different groups of people. Some patients who are HIV positive that are on treatment, they've been taking their treatment all along, they're undetectable, they're on stable treatment, they're doing really well. So these folks, they have a great immune system. Basically, these folks should be using the same precautions as everyone else. So physical distancing, mask wearing, hand washing. Really, I think we need to all be doing these things, everybody. However, there's another subset of people that we have to look at with HIV, and it's definitely the undiagnosed HIV patients, or patients that just don't know they have HIV yet for whatever reason, whether they just don't know, they haven't been tested, they haven't had access to testing, which is very complicated during COVID, or was initially. Those are the people I sort of worry about. So I was looking, and I'm going to leave some references at the end of this presentation from where I got this information. But the World Health Organization, and I'm just going to read it here, they did address whether people living with HIV are at an increased risk of being infected with the virus that causes COVID-19. And they simply stated exactly what I was saying, that if there are people living with HIV with advanced disease, so perhaps they've moved on to advanced HIV, or they have low CD4 or high viral load, or those not taking their antiretroviral medication, they are generally at an increased risk of infections and related complications in general. So these are the folks we worry about. So during the pandemic, when you look at that, there could be those people that didn't have access to testing, just undiagnosed, low immune system, and they don't even know it. So they are at an increased risk. But then you've got also patients perhaps that are having treatment failures, but aren't able to access their physician. There's different healthcare providers offering different services. And I think we were talking about how healthcare is so siloed during COVID because everyone was operating differently. Everyone had reduced hours or no hours or had canceled programs. So testing was one thing that I found was difficult. People were calling all the time to access our testing program because some of the clinics around town had to close down for whatever reason during COVID for precautions to get their PPE in place to be able to safely offer the services. So there were a lot of barriers, a lot of silos here that we had to work. And in the pharmacy, we were just getting phone calls after phone calls. All 4 of our lines were lit up all day, just not necessarily asking medication questions. They were asking just general questions. Where do I go for this? Who's open? Is this person open? Can I access this service? How do I get that? So it was an interesting time.
Yeah, and that's in a city like Ottawa. And it's like a developed city should have great access to resources, but what about these more rural areas that will reduce access? And you mentioned, thank you for bringing those things up. And you mentioned that maybe undiagnosed people should be like a kind of demographic of people that should be like more worried about COVID. And Rosie, you also touched on that earlier. That maybe from your experience as an outreach worker, what is your kind of perspective of kind of reaching out to people that could potentially just be undiagnosed?
Well, the thing is that we work a lot with the ATB community, and we work a lot with immigrants.
Could you maybe like explain that the acronym you used? Yeah.
Yeah. So ATB stands for African, Caribbean, and Black, right?
Yep.
And we also work with people who are in prison. So we know that there are certain aspects of people's lives that could make them more at risk for HIV. So people who basically, who could have, I don't know, like sex workers, for example, would probably be more at risk to contract HIV. So, and what's really important right now is that we actually have a lot of self-testing kits that OPH has put out. And I think that's really, really important for people to know that they are able to know their status on their own without necessarily having to tell the whole world or having to go to a clinic and not feel uncomfortable to do that beforehand. And I think that's really, really important to put out there, that people who are at risk of HIV, who like people who use drugs or anything like that, for them to actually be tested as soon as possible. Because that's one thing that actually stayed during COVID that we tried to implement back really quickly was the testing. Because as we've seen, like testing is like one of the most important things that can happen during that we need during a pandemic or an epidemic, depending on what we're looking at. So when we do the outreach, and it's also like not trying to shame people into doing that, because my colleagues are actually really, really great at that, even though I'm the outreach worker, but actually to make events where we know that people who are at risk of HIV want to attend, and then putting out that we actually, they should get tested ASAP. Because the face of HIV has changed, and the people who are most affected has changed, from the gay white men of San Francisco to now a lot of racialized and Black and Indigenous people of color who are not affected by HIV, and we need to look at that very seriously. So how do we make sure that we take out the stigma of being tested and make sure that people get tested? And the self-testing is like A1 for that.
Definitely, like absolutely true. The face of HIV has definitely changed. And in reality, like everyone is at risk for HIV in one way or another. But do you have anything to add, Robert?
Yeah, for sure. I think I wanted to plug this a couple of times, so that if there's any one thing that I want folks to take away from my participation in this panel is HIV doesn't discriminate. We know historically, in which it was noted in gay men. I mean, in 1981, that's even what it was called. Gay immunodeficiency disease. But as we've grown in our understanding of this disease process and how it works, we know it doesn't discriminate. Men, women, Black, white. We know that there's groups that are at higher risk because of systemic barriers. It's individuals themselves aren't at risk for HIV. It's the systemic barriers that are created that put them at risk, right? Lack of sexual health testing, the racism and homophobia that's embedded in medical systems that prevent folks from getting the care that they need. But in terms of addressing people who aren't diagnosed, and certainly working for a health and wellness organization for gay, bi, trans, two-spirit, queer, and other guys into guys, the statistics are still showing that, anywhere in Canada, anywhere between 53 and 57% of new infections are still being found in gay and bisexual men. And it's estimated that I think it's up to 1/5 don't know their status. And so, we have to be very thoughtful in how do we get those people tested. I think part of the challenge is Canada itself, in that Canada has a lot of great things about it, but one thing is really behind in HIV care. And so I was just thinking, when I think about this panel, I was thinking about my experiences in other cities and countries I've been in. Like the last time I was in Miami for Pride, which was on the beach, and there was 3 huge HIV testing kits that you can go and get tested right on the beach. Commercials on TV, banners, the last time I was in New Zealand, visiting my in-laws, as soon as I stepped off the plane, the very first sign I saw was, if you've been traveling abroad and had sex, get tested for HIV. And they had the numbers of where you can get that and go into bars. And so I think we're really falling behind in Canada is that visibility of testing and a variety of ways to get tested and access to it. Unfortunately, in Ottawa, we have pharmacy testing, we have self-testing, but I think it's really upon not just community organizations, but across the board, medical, like whatever, to really amplify that message of where you can get tested as much as possible.
Great, yeah. Thanks for, so did you want to add something, Rosie? Did you put your hand up?
And it's also about when we say meet people where they are at, that can also be physical. So are we going to those places? Going where people are is really, really important. Shelters, churches where they do a lot of work with people who are in precarious housing. So going to where people are is really important, because if we wait for them to come to us, that may never happen.
For sure. So thanks for both Robert and Rosie bringing that up. And Robert, you mentioned that systemic issues really impact the access to care. And Rosie also said we need to be able to test more. And Ben, in your pharmacy, you were helping to deliver this HIV testing pilot in Ontario. What was your experience of being able to deliver that in your pharmacy and also using the home testing kits? Did you find that helped increase access to HIV testing amongst a more broad demographic of people?
Yeah, I think this is going off both Robert and Rosie and what they're saying about access and delivering services to where people are at, and also where they're more comfortable receiving the service. So the more types of services we can do, the more niche services, creative services that we can deliver, as opposed to where you used to have to get a standard blood requisition through a doctor. Those days are over, and we're coming up with these innovative ways, such as the pharmacy delivered HIV testing program at my store is neat, because maybe people feel more comfortable coming to a pharmacy. Maybe they feel a little more anonymous or able to pop in and not so medical of a feeling. And then so that's our program is getatest.ca, and it's running for another 4 or 5 weeks till the end of September. But we're also excited for the getakit.ca, which is the home testing program that Rosie and Robert are talking about, where you can literally just go online and you will get your kit mailed to your home. So more than ever now, you can get tested in the comfort of your own home. You're still linked to care. So you're still able to be linked to a physician in the event of a reactive or positive test, because they'll want to confirm any reactive test that you do, whether it's at the pharmacy or with the Get a Kit. But these are fantastic programs that we're offering. So it's just the public awareness. Robert was saying, we lack public awareness with this still, but the more of these small little niche pilot programs that we can do and show value to the government that they're working, we're finding people, and we're finding the undiagnosed, the sooner we'll close that gap. So I think it's really exciting how things have moved in the past, even just 2 years with some of these programs. So I think it's really, really exciting.
For sure, it's really amazing the way that HIV has progressed in terms of access to treatments. And I think it's so cool and so promising for the future of HIV. But I want to move into maybe a more in-depth look at the experiences of HIV. So earlier, Rosie, you mentioned this global pandemic and also other pandemics, and it can also kind of be seen that loneliness could kind of be a global pandemic right now, something that everyone experiences and has so many health impacts. But loneliness also seems to be one of the major resulting symptoms of HIV. But maybe Rosie, continuing on the idea of kind of messaging for allies or for supporting their HIV positive friends, why do you think loneliness is such a big part of the HIV community? And what are some recommendations that you think can help people cope with this?
I mean, there's like a lot of reasons why loneliness would be part of it. I think I just feel like it's really like, okay, so imagine that you have a disease, like a virus, that everyone thinks that, like, no one knows really, like, widespread HIV education is not the thing. So no one really knows how you can catch it. So they think that you can actually contract HIV just by being around you of some kind of sort. And actually, that's not true. We know that. Okay, it's easier to it's easier to get COVID than it is to get HIV, but whatever. So when we think about people are like, oh well, if I'm around you, you're sick, you're dying, and if I get that, I might have the same. So people probably don't want to talk about it, and it's probably weighing on their minds, right? So people will kind of probably keep that to themselves and not want to talk about this. That would be one problem. So if you have a problem that's weighing on you and you don't have access to, let's say, uh, like a therapist or like a mental health professional that you can talk to your problem about, and then your feeling of community kind of decreases with that, what's happening. So I mean, it's normal that loneliness can get difficult, and it gets even more difficult if you have other things, because we talked about getting a test kit at home, but some people are houseless. So where would they get it? Where would they get a kit? Some people are immigrants, so their families are like thousands of miles away, and they're in Canada now, and they're by themselves, and they can't even, like, depending on what status you have, you can't be coming in and out of borders. Right now, nobody can go in and out of borders as they please. But just like thinking about all these things that can happen to you, it's totally like it's a given that loneliness will be part of it. It will affect some people more than others, right? So,
Nice.
so what does it look like if you are professionally, if you can make a program, what does it mean that you have a program that is weekly, that is consistent, where people can actually come and not necessarily sit there and talk about how bad it is to have HIV, but talking about, like, what are their joys and what are the other things that are in their life that can actually implement and feel the sense of community and have other conversations, because they need points of connection, right, with other people. Yeah, so like, and personally, like, if you know somebody with HIV, like, have a consistent check-in of people, like play games, even if it's online, or have like those social distance activities that you can do, because people can easily feel like they're isolated. And also connect them with people who are alike, right?
Definitely. Yeah. Yeah. Thanks for that. Sorry. Yeah, like I heard you say that, like, sometimes people are very misinformed about what HIV is, and that could like create like a lot of tension between people and not wanting to talk with others. And also looking at the intersectionality of our identities, because HIV could just be one part of our identity, but it could complicate so many other parts as well. And you also already touched on a lot of ideas of like how we can connect and support people living with HIV. But for Ben and Robert, so I'm thinking that like a lot of feelings of loneliness can sometimes be amplified, particularly during this period of social distancing during COVID. Do you have any further ideas to kind of add on to what Rosie was saying about how else we can help address like maybe loneliness and the need for social support within the HIV community? Maybe we can start with Ben.
Yeah, well, I think sometimes in the pharmacy, you're thinking of the patient, and the patient is coming in and they're getting their medication on time, so they're not missing any doses. So clinically, you're thinking, oh, that person's doing great. So you're just like, oh, the person is getting their medication, and then clinically, as a pharmacist, that's in your head. And then when the person is coming to pick up their medication, just simply asking them, like, how are you doing? Asking them some open-ended questions, as opposed to like assuming because they're taking their medication daily and they're virally suppressed that all of a sudden their HIV is fine. And I think a lot of health practitioners, unfortunately, we're looking just at those clinical values, those lab values of they're doing fine because they're virally suppressed. But just having those conversations with the patients at pickup and consultation, and just asking, like, how are you doing during all of this? How have you coped during COVID? And a lot of my staff and pharmacy assistants are great. I hear them asking these questions. I'm like, I'm really proud of them for doing that, because it's not a transactional experience at the pharmacy. It's more of a like, we're checking in a little bit above and beyond just you're taking your meds, that's great. What else is going on?
Yeah, definitely. I think like a lot of people could think of pharmacies as like a very medical environment, and that people practice from a very typical medical approach to care. And people become numbers, statistics, clinical values. But I'm so glad to hear that you and your pharmacists and people that work there like really take the time to ask these open-ended questions. And so that's kind of one thing that we can do like for everyone out in the community, just asking people how they're doing. But for Robert, do you have anything to add in terms of like what your perspective is of how we can continue to support this community?
Yeah, for sure. I think, and speaking to the first part of the question just a little bit in terms of loneliness and HIV, is that even pre-COVID, we have enough studies and evidence that we know that people living with HIV report higher rates of loneliness. And I think certainly as we've gone on with COVID, I think as a general, we all have a general understanding what loneliness looks and feels like, and how the world's been affected the last 6 months. And so that makes it really tough. And I think it's, there's solutions that we have in terms of, encouraging people living with HIV to be more mindful, to connect to community, to volunteer, to seek professional help as needed. But I think it's also where we're at, especially with COVID, and as we're talking about inequities and intersectionality, and realizing that those are much more difficult and easier to say, right? Because of social distancing, a lot of community support has been shut off, right? Because we're not meeting in person. So, now we're telling folks to meet online, but are we giving the support that they need to meet virtually? And just giving like an example of thinking of like, in Canada, we know that 20 to 40% of LGBTQ youth make up homelessness. And that's from either, a complete lack of home to precarious home situations, moving from space to space. We also know that 15 to 24-year-olds are some of the highest groups that are acquiring HIV. So you think of that overlap, right, of this very important developmental period where you're supposed to be, learning how to disconnect from home and develop social support and friends of your own and develop your burgeoning identity as a young adult. But you may not have the home support to reach that. You may not have the privacy to access a virtual space that community supports are offering, things like that. So I think it's, I don't really have a direct answer. I think it's just really important for us to be thinking individually, community-wise, organizationally-wise, to think creatively and beyond our necessary, our normal ways that we've been thinking about how to access folks.
Great. Yeah, and I think all three of you have touched on it, but it's just really important to kind of actually ask the people that we're looking to support. Like Rosie, you touched on it first, saying like, why not just ask the people what we can do? And Ben, you were saying that like the people at your pharmacy are always asking these open-ended questions to getting to know people a little bit better. But like one of the great contributing factors of loneliness could also be the ongoing stigma around the topic of HIV. And so it's been about like 40 years of HIV and AIDS activism in North America. But maybe Robert, why do you think there is still so much stigma around this topic, despite so much effort going into kind of creating like a better environment for people living with HIV?
Sex, it's, and thinking about the history of HIV, I think it was around late 70s, around the 80s, where, there was a few gay men who presented at hospitals with Kaposi sarcoma. It was in 1981 that we really started getting many diagnoses. And so, as that length of time went on for us to get a very clear understanding of how HIV was spread, it got connected to, gay men IV drug users, people who have multiple sexual partners. And those are things that even in today's age are still demonized in a westernized context, right? And so I think as long as there's a connection to sexual activity, and we paint, unfortunately, people living with HIV, we paint HIV as something that is still very much something that you get or something that you deserve for not following these moral standards that we're still addressing in today's society. And so that stigma, it's definitely gotten better, but still not where it should be, for sure. And I think, the issue is that a lot, we all have internalized stigma towards HIV. So we're all doing our personal work of undoing everything that we've learned negative that's associated with this disease. And so, folks living with it also have to deal with that on their own as well, of receiving these messages. Now you have this diagnosis, so how do you, get the skills and get the social support that you need to really overcome those barriers so that you can, move on with your best life. I'll just share one last thing, because it was also in preparation for this panel. So I was born in '79, and so, the discussion of HIV/AIDS has been with me my entire life. And I was thinking about, even from a younger age, I remember the visuals of Ryan White on TV, and when Arthur Ashe, who was a tennis legend, acquired HIV through a blood transfusion, the pictures of Princess Diana when she was holding, hands. And processing that, I remember by the time I got to elementary school, which would have been 84, 85, as kids, we were already telling each other, like, you're going to get AIDS and die. Like, just that early, it had already been cemented of what this disease was like and who was going to get it. When I was around 7 or 8, I had an incident with a family member. I had an accident in the bed, and I remember them looking at me and saying, if you keep that up, you're going to get AIDS and die. Like, so thinking about, as I'm getting older and like coming out as a gay man and becoming a healthcare provider who also is treating patients who are living with HIV. I mean, those were all just the internalized stigma things that I had to overcome and address, and still come up, in terms of thinking of preparing for this panel. So unfortunately, stigma is really deep and it's hard to overcome, and we have to keep up that work.
Yeah, thank you for sharing that personal experience from your history to kind of help understand this context. And I think it is very important to understand the historical context of HIV when we're trying to understand stigma. And for Rosalind, maybe, so you've done a ton of activism work throughout your life and organizing around race, food, and gender. In your perspective, is there anything that you've learned from all your work that you can suggest to be done to advocate for greater change to decrease the stigma around HIV and AIDS? Sorry, Rosie, your mic is on mute.
I don't want to say that I've done a ton of work, because I think I've done work, but I haven't done a ton, because I'm only 31, but I'm also 31. But but I don't want to discredit the people who have been doing this work for decades.
Yeah, definitely. Thank you for correcting me.
Yeah, and I think that is important for me to point out, because I know some people, and I'm still learning from watching people do that, and watching people and like just keep on watching people like do this work day in and day out. And I think it's important for us to not, I think there's always an edge. There's an edge that people have to walk on. They're like, oh no, I can't do this. It's like, it's against the law or whatever. And I think, I'm like, how close are you walking to that edge? Because I think that when you're talking about change and like systemic change, we have to push barriers. Like we have to push them. And like doing things, and I'm saying this like as somebody who thinks that activism is very, very valuable. And I'm not talking about and I'm talking about like the little activism, right? Because we see the people with like the big Instagram accounts and like the whole thing, but like your relationships, I saw a meme that said your relationships are activism too. And how are you building relationships with people who have HIV? Because a lot of people who have these thoughts about stigma don't even know somebody who has HIV. You will ask them, like, oh, I don't know a single soul who has HIV, or they don't know that they know that somebody who has HIV, right? So it's like, how many people with HIV have you actually ever interacted with that you actually know, right? And I think building relationships is very, very important in reducing stigma. And something happened recently. There was a documentary about HIV on Netflix, and it was saying that HIV came from Haiti. And like the Haitian people, because in the 90s it was big. You remember, Robert? In the 90s it was really big. Like, and I'm Haitian, so Haitian people brought HIV to the US. And it's like, hold on, what? So it's, and I grew up in New York when I was there. So what does it mean for you to interact with people with HIV? Because for you to end the stigma and all the stuff that you have learned, and if you have HIV, all the things that you have internalized, what does it mean to actually get your hands dirty and actually interact with those people? Actually volunteer at somewhere, at an AIDS organization or HIV organization, or like a gay men's health where, sorry, my computer's gonna die. Gay men's health where HIV is actually really, really like a big topic because we're trying to protect people. And how do you include gender diverse people in that? Because we know that, as we said, HIV has no face, it has no class, it has no whatever, but we know that if you have money, your life with HIV will look better than somebody who's broke. That's just the way it is. That's just the way our system is built. So how dirty are you actually getting your hands? Because undoing stigma is something that takes time, and you got to get in there. So I love the talk about education and awareness, but people just need to actually do the work in doing that, and do it honestly.
Mm-hmm. It's the action.
Yeah, we're looking for volunteers always. The AIDS
Sorry,
committee,
what was it?
The AIDS Committee of Ottawa is looking for volunteer always, and you'll interact with people.
Definitely. Thank you for bringing that up. You say that if you're going to do something, actually do it. And I think getting your hands dirty is exactly what we need to kind of push those barriers, like you said. But maybe Ben, do you have anything to add about how we can kind of decrease stigma around HIV and AIDS? Or do you feel like Robert and Rosie have kind of done a great job?
I think they did a great job answering that question. I mean, just treating everyone as individuals, treating everyone. I don't know, at my pharmacy, we've been doing HIV treatment and prevention for the past 8 years, and we're just treating everyone like human beings. Everyone has their story, everyone has their experience. So it's interesting when you sit down and do a med review with these folks and hearing what they care to share. Some will share more than others, and just hearing their experiences with it and listening to them. So I think again, going back to healthcare professionals, we're traditionally used to giving information, but I think we're slowly turning around to becoming better active listeners to what our patients are telling us.
That's great. And that could be seen as a way of like pushing barriers, kind of really challenging the more traditional ways of practice. And so the three of you have all mentioned that the face of HIV has changed immensely since it was first discovered like 40 plus years ago. But medication and treatments have also greatly improved to the point where people living in with HIV can now be called something called undetectable. So Ben, can you help us explain what undetectable means?
Yeah, so undetectable is when someone's on a successful treatment and their viral load goes down so low that we call them undetectable below a certain level. And this is just showing that patients can do well on these treatments, and when they're on a treatment that they find that works well for them. I think we forget that it's not always one size fits all though in HIV treatment. So sometimes finding the right treatment isn't as easy as we make it out or we see in the ads for medication. However, a lot of people are doing really well on these one pill, once a day regimens, and they're bringing their viral load down so low that they become undetectable, and U equals U, undetectable, untransmissible. And I think Robert can probably speak even more on that.
Yeah, Robert, do you want to add to that?
Yeah, for sure. And just very quickly, for sake of those, I know we in the industry use a lot of terms that are familiar to us, but just briefly in terms of, you know, HIV as a virus enters your bloodstream, attacks your immune system. And so the two big things that we look at, which are your T cells, which are specific immune cells that HIV attacks. And then we have our CD4 count, which is part of our immune system. And so we want those to be really high, and we want the virus, or what we call the viral load, to be low, so low that it's undetectable, which means that when we draw a person's blood, it doesn't come up. You know, we're not able to measure it. Yeah, and we've come a really long way, and I think, you know, something that we're also familiar with too in the industry is 90-90-90. And so what that is a international call for countries to kind of measure their success with HIV. So ideally, we want 90% of people who are living with HIV to know their status. We want 90% of those people connected to treatment. We want 90% of those people to be undetectable. So very, you know, fancy way of just saying we want as many people in care as possible to know their status and get the care that they need. So just giving that brief explanation in terms of, as been said, that's not as easy as it seems, right? Because there's systemic barriers. And we know that oftentimes, particularly with Black and Indigenous folks, that sometimes they're getting their status much later. So the disease has maybe progressed a little further than we like it to be. And so that might bring complications. And sometimes it's harder for certain communities to get to an undetectable status. You know, there's a lot of steps in place, like do folks have access to medications? If not, like how are they, can they afford it? How do we assist them in doing that? Yeah, so you know, I think it's that thing in which, once again, it's really great to applaud all the work that we've done and how far we've come, and also recognizing that there's still a lot of work to do. You know, there's still a lot of folks being left behind. There's still too many folks who don't know status. There's still, I think globally, in 2018, it was like 750,000 people that died from AIDS-related complications, which is just really scary in an age in which you can take a pill and you know, and be healthy and live almost near life expectancy, but shows that there's still a lot of barriers.
Yeah, I think I was talking a little bit earlier too about the question was coming up: are people with HIV at increased risk of being infected with COVID? There is something else we kind of have to consider, is that we are noticing that people are living longer with HIV, longer, healthier lives because of the treatments we have. But we also have to recognize that there are higher risks of cardiovascular disease, diabetes, some respiratory disease, and high blood pressure that are showing up in individuals that they're living longer, but we are finding that there are increased risks of these. And these themselves are actually higher risk factors for developing complications if you contract COVID. So we have to keep that in mind when we're talking about persons living with HIV, although they may be virally suppressed or undetectable, fine. So their HIV treatment is fine, but they may have cardiovascular disease or diabetes, which means if they do contract COVID the same way anybody could contract COVID, they could be at higher risk of complications due to COVID and end up with hospitalizations.
Great. Yeah, thank you for these perspectives on I wanted to touch on something about undetectable equals untransmittable. And because medication has become so good over the last 40 years, like people have been getting to a point where they're undetectable. But a lot of talk has been focused on like getting actual access to care to get to that point. But what about for people that are like maybe not ready to engage, or people that are living in places with decreased access? Maybe Rosie, like what do you think would be like a good like treatment model for these people?
live in places where they don't have access to treatment.
Yeah, or they're not just feeling ready to engage in treatment and medication. Like, what do you think that you can do to support these people in managing their experience of HIV?
I think getting to the root cause of why these people do not want to engage will be like helpful. I am really big on community consultations, meaning like going directly to the people and asking them what they need for them to be, for it to be easier for them to ease into it, right? Because usually when people don't want to engage in a treatment plan, it's usually because they don't trust the person who's saying it to them, or they don't trust the treatment itself. So what does it mean for us to actually build a relationship with these people over a period of time for them to be able to be comfortable and ease into it, right? Because you can't really force people to change or change people's mind, but you can definitely build an environment where it's easier for them to lean into it. That would be my first thing. Great.
Yeah, I think that's a great perspective. Sorry, I got a bit distracted because there's also a bunch of questions coming in. And I was just like kind of paying attention to the question, but also trying to listen to you guys. But I thought maybe we could field a question that just came in from the chat. This is a question from one of our viewers on YouTube. Do you think us living in a region where two provinces with different healthcare services overlap makes access to services more complicated? Does that question kind of make sense to you guys?
It's definitely on the healthcare perspective for sure. I mean, we have federal guidance on healthcare, but healthcare is delivered provincially. And living in Ottawa, where a river separates Quebec from Ontario, it always poses challenges because there's just certain levels of care they're getting across the river and certain levels of care they're getting here. And then when provinces are mandating different, everything even from the face opening during COVID to what they're recommending for stores and businesses. So we see it, we've seen it with COVID. So it does make it harder to navigate. I often see patients coming from Quebec or who are just relocating to Ontario, and there are challenges saying, even though we all live in Canada, here's how you have to do it in Ontario. So yeah, there are definitely challenges there, and knowledge is power again. But again, other people require different levels of assistance navigating the system because the systems themselves are just so layered and complicated, and we need pharmacists and social workers and physicians and nurses. We need everyone to work together to help the patients navigate this complicated system that each province has designed.
Definitely. Can you recommend a place where people might go to get some of these answers to help navigate the system?
I think, yeah. Does anyone have a?
Yeah, Robert or Rosie, like working in the community, is there a place where you can recommend that people can go to get answers of how to navigate the two healthcare systems that they're kind of like living in?
I would suggest, this is where sometimes I don't feel the most suited, because I'm coming from the US. I'm very confused by the community healthcare system, especially what it means to be living in between two provinces. So I feel like I'm constantly asking myself these questions, even for my own care. Yeah. But I would say, in terms of recommendations of places to go, you know, on the Ottawa side, we have some really rich services. Of course, MAX, we have, of course, the AIDS Community of Ottawa. A lot of community health centers are very explicit about what services they offer and don't. And I know on the Quebec side, Broad Ottawa, which is an AIDS service organization equivalent to ACO, they also have a gay men's sexual health division called Entromes that does a lot of great work in terms of providing resources. But one thing I will add too is that, you know, in thinking about this work and being allies and accomplices, is that, you know, sometimes it's also about helping folks leverage whatever system works best for them. We have a lot of people that, you know, live, work, and play in the capital region. And that sometimes folks have to do what they have to do to get the care that they need.
Great.
And just leave it at that.
Great, thanks for that, guys. Do you have anything you want to add, Rosie?
No, that was great.
Yeah, okay, great. That question was submitted by Scott Simpson, so thanks, Scott. And hopefully that helped answer your question. So I think we have time for maybe like one more question. So during this time, also to kind of go along with the available services in the community, during this time, Robert, how did you see HIV services specifically impacted during this COVID time? And what is the state of them now during this staged reopening process?
Yeah, and I think I mentioned this earlier too, but you know, across all services and systems, we saw either reduction or things stop. So I think there was periods of time in which, probably about a month or so, in which there was very little for all folks, right? But if things have opened up, it's been really, you know, a lot of organizations, including Max, has tried their best in doing specific COVID resource pages. And so fortunately, I have to give a shout out to Ottawa Public Health. I think that they've done a really great job in keeping everyone updated as quickly and as efficiently as possible in what was up to date. And I would say the most common question we got at Max was just general sexual health testing. And so fortunately, Clarence Street, which is the sexual health testing center, opened later in the spring, but via appointment, which I still believe is the case. You have to call and schedule an appointment. And also recently, Gay Zone, which is Guys and Gas Sexual Health Testing Center. It's usually open on Thursdays at Centertown Community Health Center, but it's presently running on Clarence Street on Thursday evenings, also by appointment.
Okay, great. Rosie, like as an outreach worker, do you think there are any other resources in the community that have maybe reopened during this time that you think people would like to know about?
No, I think that Robert touched on them all. There was a service that we offer, which is like a primary service that we never stopped, even during COVID, was the food bank. And I think with the ACE Committee of Ottawa, and I think that's really important because you will be surprised, because there was a time when people were like stress buying at the beginning. So people didn't have like, and luckily the food bank had like stuff like toilet paper that people were fighting over, Lysol wipes, and all these things that we had. So I think that people should actually get plugged into that because we'll always have enough food for everyone. So please reach out to us for that. We're slowly opening other things, but they're not face to face, as they'll still be online.
Okay, great. And finally, maybe Ben, are there any specific changes to your pharmacy that have occurred as things are reopening? Like anything you want to share?
Yeah, so as I had mentioned earlier, it was just everyone's kind of in shock with everything shutting down, locking down, and nobody really knew. Robert was alluding to this too, like what was open, what was closed, what had changed to virtual offerings, what services were being offered. And even just as an individual and as a person myself, I was going through, our pharmacy never closed, but there was a lot of stress with just maintaining day-to-day business. So managing the questions of what's open, who's doing what, it was very confusing. Luckily, things did turn around, and a lot of things went to virtual appointments, blood requisitions being able to be securely sent to you. But again, it's all about access. So what about these patients that don't have internet or access to email? I mean, there's going to be challenges, but I think we're doing a good job. A lot of things have opened up now. My HIV testing program, we did stop for a few weeks, but what I quickly found was that with Gay Zone being closed and Sexual Health Clinic was doing limited appointments, there was a need for rapid HIV testing. So we did just kind of suit up and gear up. And once we had our personal protective equipment set up, we did resume the service, which was pretty cool.
Cool. Yeah, it's so nice to hear all these things reopening, because like I think people are definitely craving like some sense of normalcy. And I know things are still online, but I'm glad that things are also offered in person for people now. So I thought we had only time for one more question, but I think we have time for one more question. Just maybe the last one. So as we're going through this global COVID-19 pandemic, Rosie, do you see any parallels with the global HIV crisis? Is there anything that we should take notice from the HIV/AIDS crisis that can help us better cope with the current pandemic?
Well, we need to make sure that testing gets out as quickly as possible.
Yeah.
I really want to travel, but I think that, and I think that we didn't have, during the AIDS crisis, it was, the media was there, but it was not as the media that we have now. Like now we have like information that comes on. If you want it, you can have information that never stops, to the point where you can drive people up the wall. But I think it's important to have accurate information on what you're talking about, and to know that, and to be flexible, because things are going to change quickly. What happened what's happening right now is that at first, when the COVID-19 came out, it was it's a death sentence if you're 60 and over. Like, you're gonna get it, and there's nothing the doctors can do for you. It's trial and error. And when there was the HIV crisis, like, you get HIV, you're going to die right away. And slowly but surely, now we're seeing that COVID has, like, there was a 19-year-old that died in Montreal. So we know that that's not necessarily true. So we need to keep on going with the information, because as the doctors are finding out, just as we're finding out, like, this is new for them, right? And I think a lot of people survived the HIV crisis with a lot of hope in terms of like when treatment is going to happen. And now look at what HIV is. If you have proper treatment, you can live like a normal, active life, just like anybody else. And I think it can be the case for COVID as well. But we need to be able to be flexible in what we learn and how we're going to need to change our lives compared to that. And I think that's really, really important. And like, I mean, yeah, get the proper information, because there's a lot of information out there, and I don't want COVID to become this thing where it becomes highly stigmatized for anybody who has it. Because imagine what happened to people who had HIV and passed it on to someone else without knowing. That was really, really hard on people and people's mental health. And it's happening now when people are like, oh my God, I gave it to my mom, or I gave it to this person, and it's my fault. Like, no one knows what's happening, and to like give ourselves grace and time for us to get this under control, because it's going to take that for sure. But please, Government of Canada, get the test going, make it cheap, make it free, so people can actually get it, so I can have it in my pockets and travel.
Yeah, so hopefully for Justin Trudeau, you guys have heard that. So like misinformation is maybe like one of the biggest things that could like really impact like the spread of a pandemic. But Robert and Ben, do you have anything to add to what Rosie said?
I think Rosie hit the nail on the head about misinformation. Get your information from a reliable source. Can't stress that enough. What we see on our Facebook feeds isn't necessarily the truth, and there is a lot of information coming, like Rosie said. It's flying fast and furious, and we need to just day by day continue to adapt with what we're learning about the virus. And again, she also made the great point about testing. Testing is key, so keep testing.
Yeah. Hey, Robert, maybe from like Max Ottawa as a communications coordinator, what do you think you can do to kind of support like the dissemination of like accurate information?
Yeah, 100. All in line is accurate information. I know on our website, we've been doing our best to keep everything up to date. We've also created or initiated a lot of programs to help with folks' mental health at this time, increase their connection, keep them aware of what sexual health testing is out. So I think that's really important. And I just wanted to speak to answer the question too, in terms of the overlaps between like what we're learning from HIV activism and COVID. And just want to stress the point that I think for me, what I'm seeing is that everyone has value. You know, it's, you know, when we first learned about HIV and who was getting it, that kind of dictated the response, right? When it was in gay men, peak homophobia, when we were finding out drug users and where we're at with harm reduction, there was such a slow response. And HIV activism really taught us that everyone has value and that everyone deserves to get access to the care that they need. And I think that's what we're seeing with COVID as well. I think, you know, when COVID was in nursing homes and away from us, you know, it really got into, you know, a lot of where we're at with age phobia and who has value, but as it's spreading more and more to the community, and it shouldn't have to take certain segments of people to be adversely affected, like where we're seeing COVID, you know, largely in lower income, racialized folks, to have a gracious response to this, you know, to this disease. So yeah, you know, keep up with best practices, wash your hands, wear a mask, social distance. Hopefully we'll have a safe vaccine for us all in the meantime. And just be reminded for us all to have grace and patience with ourselves.
Great. Awesome. Thank you so much, you guys, for this really like very in-depth conversation today. And I think a lot of useful information has come out of it, and hopefully like our viewers learned something. They can spread accurate information to the community. But to conclude, as you're all like very involved with your communities, like are there any current initiatives or upcoming events, projects, resources, or any last information that you'd like to share with our viewers before we sign off? Maybe starting with Rosie.
Well, we have a list of Pride events that are going on. You can find us on Facebook and look for AIDS Committee of Ottawa and look up at our Pride events. Some of them are fun, some of them are actually outside with the measures, so make sure that. But we have a lot of fun Pride events online that includes rope tying, like rope bondage 101, so please come to that.
Okay.
So yeah, just check us out on Facebook, so at AIDS Committee of Ottawa, or on Instagram at AC Ottawa.
Awesome, thanks. Robert, do you have anything to share?
Yeah, for sure. So as I mentioned before, Max has a ton of new programs and initiatives. So if you go to maxottawa.ca/programs, we have been able to start a harm reduction dispensing program. It's either online and we'll deliver the items to you. You can pick up in person certain days of the week, of course, with safety precautions. In partnership with the Ottawa Senior Pride Network, we've started a technology lending program where, of course, seniors can pick up a tablet so they can get access to virtual online resources. We're also working on creating some events to help folks who may not be familiar with that use. And in terms of mental health, we've continued our mental health navigation program. We've started a peer support program with volunteers. So Mondays and Thursdays, guys and gals in the area can get a listening ear from a trained volunteer. I know I'm missing some things. There's been so many. We reinitiated our coaching program, which is 4 to 6 sessions with a trained coach to help meet goals. We just soft launched that over the weekend. So yeah, tons of things to check out from Max. I also, in my bio, mentioned I'm part of the Black Gay Men's Network of Ontario. So we've been doing a lot of work to build up provincial resources for Black gay men in the province. So we had hosted some virtual events this spring. We're hoping to host some more. So if you're interested in getting involved, please do that. And yeah.
Great, thanks. Ben, anything you'd like to plug for yourself?
For sure. I did mention a couple programs earlier, but first, Rosie and Robert, wow, you guys do so much. You guys just listed all those amazing services. So thank you so much for providing these to the people of Ottawa and the region. I'm just continuing to work on the getatest.ca. So that's our pharmacy rapid HIV testing program in pharmacy, which will be wrapping up in September. However, we're transitioning and helping support the getakit.ca program, which is where you can have a kit mailed directly to an address so you can do self-HIV testing. Of course, if there's any personal or private medical questions regarding medication, HIV, COVID, please feel free to stop by my pharmacy at Shoppers Bank and Gladstone, or contact Capital Pride with the question, and I'll get back to you as soon as I can.
Great, thank you so much. And also Capital Pride, they've been posting all the information that Rosie, Robert, and Ben just shared into the chat. And also, I think they'll post it onto the webpage, so the website, capitalpride.ca. So you can check out all the resources that Ben mentioned, Robert and Rosie as well. And I hope all the viewers use them.
And before we go, I just want to give a special thank you to Victor for doing such a great job facilitating the discussion. Really.
Yeah, thank you. But thank you guys for providing such great discussion. But also, I'm blushing. But also, if the viewers have any other questions that they'd like to ask either myself, Robert, Rosie, or Ben, our contact information is going to be put on the Capital Pride website. So you can always reach out to us by email as well. So I really hope everyone enjoyed this conversation and found it helpful. And I hope the panelists enjoyed it as well. Like I really did. And I definitely learned a lot. So I hope the community did too. Great. Thanks for joining us, everyone.
Thank you, everyone.
Everyone.
Thank you, Victor, Rose, and Ben.
Great. Thanks. Bye, everyone.
Bye.